Nancy, care transformation, we know, involves the coordinated adoption of key technologies, EPIC in the ambulatory environment, upgrading centricity in our hospital environment, supporting all caregivers toward computerized provider order entry, and migrating to ICD-10 as our core basis for coding and structuring so much of our data. All that is the work of care transformation, but talk a little bit about what it means for the care that we're going to be able to provide and what it means to our caregivers.
Yeah. I don't think caregivers are inspired by new technology. I think they're inspired by providing better patient care, and these tools are designed to do that. Imagine having a system that would give you the information you needed when you needed it. Imagine teams having everything they needed to provide the care, whether they're in the ambulatory setting or the inpatient setting. Imagine not having variation, whether you were in Ketchikan or in Bellingham, or whether you were in Oregon or you were in the Columbia region. Imagine having better documentation systems. Think about how much time our caregivers would have if we had systems that would enable them to be providing more care rather than writing about the care. I'm excited about these changes. I think Peace Health will be better able to deliver on its mission with better tools so caregivers can provide care and not document about providing care. That's exciting to me. One of our goals is to improve the Peace Health experience, but we've heard time and again from nurses and other caregivers that to do that we need to have a common care planning model as a foundation for change. And this model is going to be really important to have it standardized so that we do have one Peace Health experience. And the model has to include the 5 patient goals, the goals of comfort, of safe care, making sure that all of the care supports the patient's individual medical treatment plan, that patients receive the education for a safe discharge so that they don't have to be readmitted. This is fundamental, and to do this in a reliable way, every time, every touch, means we need systems to help support each of us as caregivers who try our best to do this all of the time, but we know without the support of technology, every time, every touch is going to be much, much more difficult.
Florence Nightingale wrote in her publication Nursing Notes that I use the word nursing for want of a better. It has been limited to signify little more than the administration of medications and the application of poultices. It ought to signify the proper use of fresh air, light, warmth, cleanliness, quiet, and the proper selection and administration of diet, all at the least expense of vital power to the patient. How is Florence's message relevant today?
Keeping the patient comfortable and safe has always been at the center of nursing care. These actions provide a vital power to the patient, the power to heal. In the rapidly changing world of healthcare, nurses are ready to address the challenges of increasingly complex care. This is an opportunity to partner with our patients and to provide the best experience and outcomes. We are creating elegant and efficient processes which are an expression of nurses' intellectual, technical, and caring work.
It is time for us to make a purposeful and conscious change in how we deliver nursing care. Conscious change is a transformational process. It takes time. In a recent article published by the American Holistic Nurses Association, titled Conscious Change, a Zen Perspective, we are told that we are living through the most exciting, challenging, and most critical time in human history. Never before has so much been possible, and never before has so much been at stake.
Change in healthcare is inevitable. The Sisters of St. Joseph of Peace created a legacy of successfully responding to change. It is our collective responsibility to continue that legacy. One thing that has not changed and will not change is our mission and values, which remain as our foundation, always. Carrying on the healing mission of Jesus Christ by promoting personal and community health, relieving pain and suffering, and treating each person in a loving and caring way. This is our mission. The nursing redesign is our opportunity to transform care and deliver on our promise.
As we work together in this ever-changing healthcare environment, it is essential we not lose focus on our vision to ensure every person receives safe, compassionate care every time, every touch. This vision guides our nursing care design focused on 5 patient goals: comfort, safety, medical treatment plan, safe discharge, and education. Dr. Sanford wrote in her article, The Keeping of the Flame, that these interventions heal, ease distress, comfort, and keep patients safe. They also represent major best practices as hospitals strive to increase the quality of their patient care.
This transformation takes creativity, time, effort, and flexibility from every caregiver. The System Nurse Practice Council, including nurses from all Peace Health communities, have partnered with other interdisciplinary caregiver teams to design the new patient care process. Over the course of the next several months, further information will be shared with all caregivers through several avenues, including awareness campaigns, traveling shows, future videos, class participation, and other information and knowledge sharing opportunities.
The Institute of Medicine's report on the future of nursing states that nurses can and should play a fundamental role in healthcare, especially during this time as the healthcare system of the United States undergoes major changes. As we move to a new and improved model of care, nurses have the ability and the responsibility to influence the future of healthcare. We, the patient care executives from all the Peace Health communities, want to thank each and every one of you for your commitment to carrying on our healing mission. We leave you with these words from Sister Catherine McCauley, a nurse and contemporary of Florence Nightingale.